Good morning and a very warm welcome to each one of you present there. I I'm very happy to bring greetings from the entire Getty fraternity as an ambassador of change and host to you all this morning. Holding the beacon of success, I bring greetings from the Global Education and Training Institute on this live forum of detox for educators. So, steering this session ahead, as we usher in winds of change, I warmly welcome our esteemed speaker, Dr. Mirza Wakar Beg, on this happy occasion of Doctors' Day. Sir, we wish you a very, very happy Doctors' Day, and I wish all the other doctors out there who are doing just a wonderful job. I think your profession is one of the noblest of professions because people look up to you as lifesavers after God. Dr. Baig is here with us to share his views on the topic role of doctors as healers. Dr. Baig is also a consultant pediatrician and neonatologist. He is also a director of Dr. Baig's Childcare, a fellow of Indian College of Maternal and Child Health. He's here to enrich us with his views on doctors as healers. So over to you, sir.
Thank you, Zoya ma'am, for the nice introduction and happy Doctors' Day to all the doctors across the globe. And I must thank Getty for giving this opportunity on this special Doctors' Day to me to be live on with your organization and sharing my thoughts. So today, actually, we'll be dealing with the topic of role of doctors as healers, because we are seeing a lot of good things, lot of bad things. We have just gone through the pandemic, and uh, we have lost so many doctor fraternity, the nurses committee. We have lost them. Lot many have lost their lives, saving the lives of the people. So uh, let me share our thought of about the doctors as healers, because these days this art of healing is disappearing gradually, and doctors are being as doctor are being labeled as being commercials. They are being businessmen, and they are just working for the money, and they've lost their humanity. So I thought, let me choose this topic today on Doctors' Day, just to share my thought that what as a doctor, what do we think, and where we need to compromise, and where we need the support of our community to work smoothly in this scenario. So, coming on the Doctors' Day, let me tell you the importance of Doctors' Day and why it is celebrated in India on 1st of July. So, National Doctors' Day is celebrated in India, all over India on 1st July. This is to mark the respect to our well-known architect of medicine, uh, Dr. B.C. Roy, who was a very good doctor. He did a lot for the medical sciences. He was a professor in Calcutta Medical College. He established National this Medical Council of India. He established in the Indian Medical Association, and then he was the chief minister. He was a freedom fighter as well. He was the chief minister of Bengal from 1948 till 1962 when he died. And 1st July is his death anniversary as well as his birth anniversary. That's why in 1991 it was decided that we'll celebrate Doctors' Day to honor this great doctor, Dr. B.C. Roy. So here we are celebrating this day today all over India. Doctors' Day is celebrated all over world, but on different dates. Like in USA, it is celebrated on 30th of March. In Iran, is celebrated in somewhere in I think August 24th. So there are different dates for different countries, but in India, it is 1st July, just to mark the birth and death anniversary of Dr. B.C. Roy. So coming to the topic, doctors as healers, and as I said, the doctors these days are losing this art of healing, as perceived by our community. And let me discuss that doctors possess knowledge and experience which can not only help people but can save their lives. We get opportunities to be the right person at the right time to offer the right help that makes all of the difference. It is one of the greatest things about our profession, but it is one of the greatest traps as well, because there are a lot of expectations from the doctors. And these days, as I said, uh, there are three type of doctors. Like if we go to the community, we'll find government doctors, we'll find doctors in a private clinic, we'll find doctors in private hospitals, and there are corporate hospitals. Now, all doctors, these all four set of doctors have different sort of problems. The problem with the government doctors is that they are overburdened, overworked, and they are working round the clock without taking much rest, and they are the four on the front line, uh, to be beaten up or by the scolded by the masses. So this is one lot of doctors. Then second comes the doctors in the private setup in the private clinic. Obviously, as we said, that most of the brilliant students of our classes, they opt for doctor or engineer. Then those who are continuing to graduation, then they appear for different exams, and then they go for IAS, IPS, and other exams. So the cream of the society, I think, PMT is one of the toughest exams, I must say, and the cream of the society enters into this profession. But these days, seeing the I mean the position of doctors, I think most of the young generation is not opting to become doctors. Even the doctors, son and doctors, while they see the situation of doctors, their parents, that how badly they are treated in the society, they are not opting to go into this profession. They want to have money and they want to enjoy life. The problem of the doctors, I think, I must say that recently there was a very good article about of Chetan Bhagat, and who said that doctors are made the scapegoat of our poor health infrastructure system, because our government is spending very little on health and education. We are spending. So to the let me come to the infrastructure of health system of the government. The population norms for setting up a public health facilities are as under. A sub-center is 1 per 1,000 population in general areas and 1 per 3,000 population in difficult or tribal or hilly areas. A primary health center or PSC is per 1 PSC per 30,000 population in general areas and 1 per 20,000 population in difficult or tribal hilly areas. Community health center, which is called CHC, is per 120,000 population, 1,20,000 in general areas, and per 1,80,000 population in difficult and tribal areas. This is an ideal situation, but this is not the exact situation on ground reality. There is plenty of sub-centers which don't exist. Even if they exist, they are closed. There is no doctor, there is no nursing staff. Even in the PSCs, if there are three doctors appointed, there is a surgeon is appointed, but anesthetist is missing, so they are not able to do the proper care. So here, as per the rural health statistics of 2020 the status of public health facilities functioning in the country is as under. We have got only 1,057 1,57,921 sub-centers, 30,813 PSCs, only 5,694 community health centers, and 1,193 subdivisions. You can see a population of roughly 1.5 billion, and we have got only 1,193 subdivisional hospitals and only 810 district hospitals in the country. So you can see the situation how the doctors working here are overworked by the uh, uh, infrastructure. Noting the low doctor to population ratio. I mean, in India, the WHO norm is that we should have one doctor every 1,000 population. But India, we have got one doctor for roughly 1,511 population. There is a need for creating more medical colleges in line with the government's intention of setting up one medical college. Like our Prime Minister has announced that they'll be opening one medical college in every town so that the number of doctors increase so that we are able to serve in a better way on a rural level, suburban levels, and different tribal and hilly areas as well. And coming to the nurse population issue, it should be 1 in 3 and 1 is to 300, but in India it is 1 is to 670. It means the almost a nurse has to work, I mean, the double of her capacity. Speaking at the convocation of the University College of Medical Sciences, New Delhi, the Vice President, Mr. Venkaiah Naidu, noted the improvement in different health indicators since independence. Definitely, there is no doubt that we have improved a lot since the India became independent, but there is still a lot to be done. At the same time, there are many challenges that required a coordinated and connected approach by both the government and the private sector here. I must tell you, the private sector is the main delivery of the giving the main delivery of the health system these days, because the government hospitals are busy, the facilities are lacking, so the people are shifting toward the private setup. Now the problem is not because the private setups they'll need money because they have to run the hospital, they have to make the setup. There is a cost involved in the infrastructure, so they do charge money, and the people are not. They are not accepting it the fact that doctors also need money. They think that the doctors should do all the time charity. We are doing charity. There is no doubt about that. I think every doctor sitting in his chamber, we are every day seeing lot of patients on free of cost or giving the free medications or free discounts on the on the bills. But still, they expect that a doctor should not charge. But the cream of the society, as a doctor, we also deserve a decent living, and we also need that our children should go to a good school. So here is the problem. This is the main, I think, crux of the problem. Mr. Naidu stressed that the first step to achieve goal health for all is to increase public spending on health. We are spending around roughly more than 1% of our GDP on health. So Mr. Modi, our Prime Minister, Honorable Prime Minister, has announced that we will increase the spending on our health infrastructure to 2.5% of the GDP by 2025. So India just spends a little over 1%, roughly 1.4%, I think, of its GDP on public health, despite an increase in health expenditure since 2009, according to the National Health Profile data. While India's per capita public expenditure on health has increased more than twice, it used to be 621 per person in 2009 and 10, and it has increased to 1,657 in 2017-18. This, mind you, this cost is whole year cost per person in 1 year. Let's see what is United States spending. 18% of GDP is the USA is spending 18% of GDP, whereas we are spending only 1.4% of our GDP, which is roughly over US dollar 10,000 per person per year. So here is the difference. If our government starts spending more on the health infrastructure, spending more on per person, definitely the resources will be available to most of the people, and doctors will get time to heal them and to serve serve our population in a better way. The NHP data also shows that the cost of treatment has been on the rise in India, which has led to the inequity in access to the healthcare services. The government hospitals, obviously, the services are free of cost, but there is a long queue. The appointment, if you go to different big hospitals, you may get appointment after 1 month or 2 months for a surgery. Sometimes after 6 months they are for a surgery. So the patient looks towards private setup, and obviously private setups they have to maintain their I mean the infrastructure, and they need money for that, and they do charge. So here is the problem. Yes. So, what does the community expect from doctors? They expect that they should be brilliant, they should be willing to study for decades, they should be willing to work in adverse conditions, they should serve in far flung rural areas, and they should feel guilty about making money. They should take responsibility of anything going wrong, get beaten up by the angry mob from time to time. So, I mean, this is the situation we are dealing with today. That our community expects from us that it should be. And what do we expect from our community? We expect nothing but a respect. People need to realize that doctors are not responsible for poor health system in our country. It is the part of the government, the state government, the central government to provide the good infrastructure where everybody can be treated in a appropriate manner, timely interventions are done, and timely referrals are done, and doctors expect to we do expect to lead a respectable life and earn reasonable money for our living and our kids' education. So, seeing all these scenario, who is at loss? Is doctor at loss or is community as well? I think both. Doctor as well as our society, both are at loss because the bond between a doctor and a patient is being broken now. Patients are no more trusting their doctors. If we write some test for the patients, if we write some medicine for the patient, they have a suspicion that, oh, this doctor might be having some commission from this lab, that's why he's asking to get it done, this test, or he's writing this heavy the costly medicines because he may be having some tie-up with some pharmaceutical company. So the bond is broken, the trust is not there, and I think because of this, both are suffering. We as a doctor sitting in the clinic, we feel that how can we satisfy the patient that look, we are doing it for your good. It's nothing that we are going to get it back. So most of the brilliant students now do not want to become doctors anymore. As I said, even my kids, only I have got three daughters and only one opted to become a doctor and just said, no, no, dad, I've seen you working all the time and I don't want to be a doctor. Qualified doctors prefer to go abroad, leading to brain drain. When the situation is so tight, the doctor recently you see Dr. Archana, she committed suicide because of the pressure from the society. So why should we work then? If the community is beating us, if the government is not supporting, if the police is not with us, why should we work for the people? So a lot of our young brains are going abroad, going to USA, going to UK, going to Middle East to serve and have a better life. Most of the private hospital owners are closing their hospitals due to unnecessary pressure on them. Lot of pressures from the you can say the different government departments, lot of pressure from the society, lot of pressure from the people. Most of the private hospital owners I know, their children are grown up, they said I don't want to do it anymore. They are closing their hospitals, they are selling their property in crores, making a mall or somewhere something like that, and they want to enjoy their life because whole life they have spent treating the patients, but what they have got in return, nothing. Only uh, the tag that he is a cheater, he is a lutera, or whatever you can call it. The serious patients suffer. I think this is the point I want to emphasize through this live session, that the loss is of serious patients. Serious patients suffer because they are referred to higher center in fear of manhandling in case the patient dies in the hospital. Suppose a patient is coming to my hospital and he is serious. I might have the feeling that I can treat this child, but in case if the baby dies in my hospitals, what is going to happen? I may be beaten up. My hospital, the window panes will be broken. My NICU will be broken. So what I do, भैया आप इसको मेडिकल कॉलेज ले जाइए क्योंकि वहाँ पर आपके ट्रीटमेंट ज़्यादा बेहतर हो सकेगा. So I think this the loss of this trust, the beating of doctors, the manhandling of doctors is the society is at a greater loss because the serious patients are not being treated at a peripheral hospital or small private setups because they say either you go to the corporate hospital where you spend lakhs of money, and I must tell you the corporate hospitals are not owned by doctors. They are all owned by either politicians or businessmen. So they are charging heavy amount of money. It's the only if you are paying like 5 lakhs of bill in a corporate hospital, I think the doctor treating you will only get 10 to 20% of that 5 lakhs. So you don't have to blame the doctors in the corporate hospital. don't have to blame the doctors in the government setup. You cannot blame the doctors in the private setup because everyone has got a different set of problems, and the money is not going to the doctor alone. Private hospitals, I must emphasize that they should be encouraged by the government, they should be encouraged by the society, because we are the one who are creating jobs. I mean, if a private hospital is opening in a society where they are offering jobs to the nurses, they are offering jobs to the pharmacists, they are offering jobs to the common man, as a receptionist, as a ward boy, as a sweeper, as a janitor, as a guard. So the private hospitals should be seen as a job openings for the society, and the government, we are contributing in the health infrastructure of our society. So the government should also respect our small private setups, the big private hospitals, so that we should be encouraged to work in a better way, and we should more doctors should open hospitals, and doctors, the brain drain should stop. The young doctors who are very brilliant, they should not go abroad. So as I said, the loss of trust, the doctor patient bonds has become very weak now, since the patient is a consumer. I mean, another this the Consumer Protection Act has led to a lot of I think bad things, because this is the basic. अब आप जब कहते हैं ना कि डॉक्टर बिजनेस कर रहा है, जब पेशेंट कंज्यूमर हो गया तो डॉक्टर बिजनेसमैन अपने आप ही आपने बना दिया, गवर्नमेंट ने डॉक्टर को बिजनेसमैन बना दिया. Doctor becomes a businessman once the patient becomes a consumer. Now, even if I am seeing a free patient as a charity, and something goes wrong, he is liable to sue me for crores of rupees. And where should I bring these crores of rupees? I have not earned much money. Even a doctor who is I mean, spending a decent life cannot give crores of rupees as a compensation. So I think this Consumer Protection Act, since it came into being, the scenario has totally changed, and it has weakened the bond very strong. I mean, very it is one of the main factors that the doctor trust bond has broken. So the bond of love, care, and respect is no more there. So I think we need to revive this bond, because we as doctor, if you see that initial days, the doctor used to be a family doctor. Everyone was having confidence in them. They will treat. But now, if you talk to somebody, if you, they'll say, no, उस डॉक्टर के पास गए थे, उसने इतने का टेस्ट करा दिया, इतने पैसे ले लिए, और मुझे कुछ फायदा भी नहीं हुआ. तो I think this is the scenario these days that we are suffering. I am not saying that all on our end is good. There may be some shortcomings of us as well. I am ready to accept that. But it doesn't mean that you will beat us, or you will manhandle us, or you will abuse us, or you will create ruckus in our hospitals. So my appeal on the Doctors' Day to all the community members, to all the doctors, I'll respect I'll request our community that support your doctor community. We need your support to work in a better environment. We need your support so that we can take risk in a serious patient. We need your support so that we can treat serious patients. We have all gone through the pandemic in the last 2 years, and you will not believe more than 2,000 doctors have lost their lives uh, saving the lives of common man. In the second wave of COVID, almost 594 doctors, they died in roughly 1 month of time. So on an average, 10 to 12 deaths per day we have seen in the second wave of COVID. And in the throughout the COVID, almost 2,000 doctors, and if you include the nurse, the number goes even higher. So these are warriors. We respect our army men. We respect our Fauji, because they are saving our lives on the borders. Yes, we do that. We all respect for our army men, our soldiers. But we are doing it every day. The soldier is saving your life in that time of conflict, but a doctor is saving your life every day, round the clock, every minute. A doctor is fighting and struggling with his patient to save his life. So we need your support. The doctors need the support for the community. Don't put your I think we need to put pressure on our state and central government to increase the health budget. 1% GDP में आप क्या कर लेंगे, आप बताइए. आपके हॉस्पिटल्स में दवा नहीं है, आपके हॉस्पिटल्स में बेड नहीं है, आपके हॉस्पिटल्स में ऑक्सीजन नहीं है. इसका जिम्मेदार डॉक्टर नहीं है, इसका जिम्मेदार हमारा हेल्थ सिस्टम है, इसका जिम्मेदार हमारी स्टेट गवर्नमेंट और सेंट्रल गवर्नमेंट है. So GDP, as our Prime Minister has said, Modi ji has said that he will increase to 2.5% by 2025. But I think it needs to be increased more. Our committee needs to ask our MPs and MLAs of your area to improve the health infrastructure. सबको पैसे मिलते हैं, अपने बजट मिलता है अपने एरिया को डेवलप करने का, भाई उनसे कहो कि आप हमारे अस्पताल को डेवलप कीजिए. आस्क देम, don't be doctors, don't ask doctor. He is not there to provide infrastructure in a government setup. The infrastructure will be provided by the government. Please ask your MPs and MLAs of your area that they should improve your health infrastructure in your village or your town. Let's work together in improving health service of our country. Doctors, patients, our society, we all need to work in unison so that we can increase the uh, health productivity, we can increase the outcome of our health system, and we can save so many lives which are lost during transfer from one hospital to another hospital, which are due to the bad ambulance services, due to bad transport facilities. And I think we should encourage our children to become good human beings first. uh, what we are seeing these days, lot of protest. We are encouraging this gunda culture. We are encouraging this bhid tantra. So it is a loss of the society. जब तोड़ फोड़ होगी तो कहीं भी हो जाएगी. आपने देखा recently we saw that Agniveer protesting on the roads, burning trains and burning buses, beating people. So I think we as a society need our children to teach them कि भैया पहले अच्छे इंसान बनो. आप अपना जो प्रोफेशन चूज कर लेना, बट पहले इंसान बनो. अपने कंट्री की, अपने सीनियर्स की, अपने बड़ों की रिस्पेक्ट करो, अपने कॉन्स्टिट्यूशन की रिस्पेक्ट करो. एंड जो आपको बनना है बनो. इफ यू वांट टू बिकम डॉक्टर, इट्स फाइन. इफ यू डोंट वांट टू बिकम डॉक्टर, it is your choice. But whatever you do, first become a good human being. Start respecting your infrastructure. Start respecting your uh, the infrastructure you have, the resources you have. So that was all from my side. And happy Doctors Day to everyone. Again, my appeal that we as a doctor need your support. We as a doctor need your cooperation to serve us in a better way. Please, I will request that all. I'll thank you everyone for the patient listening, and thank you everyone for the wonderful comments. Stay happy, stay healthy, and if there are any questions, I'm ready to answer. Thank you very much. I'm not able to listen to you, Zara.
Thank you so much for reminding me that I'm muted, sir. Thank you for that wonderful presentation.
Okay, ma'am.
And
You're welcome.
your points were so relatable, so relevant in the present scenario, especially during the COVID. We have seen how the frontliners have literally worked 24/7, sir. They have not bothered about their own families, but have been there to save lives round the clock. And I think that was the best kind of service that anybody could expect from any human being. So I think Getty, on behalf of the entire, mankind, I think we need to congratulate the frontliners, and we need to thank you from the very bottom of our hearts that you have been a source of uh, saving lives. You have been a source of inspiration to so many other people who voluntarily went out to help, seeing that when the doctors who are also at the same amount of risk are there out in the open doing their very best day and night, then we sitting at home should also lend a helping hand in whatever way we can. And that was truly inspirational. You included some very valid points in your presentation, that what is generally expected from doctors and what do the doctors also expect from the people. I think that's very, very relevant. uh, we all know that after God, you are the only hope for all of us. We look up to you as healers, as lifesavers, And the life of doctors is really not easy. You're working 24/7, sir, balancing between your homes and your family life and not letting your patients feel neglected. So it's high time that we all rise up to the occasion. We realize what a wonderful job the doctors are doing. And also the request that you have made that the facilities need to improve, the infrastructure needs to improve so that our young generation feels motivated to go ahead and serve even in the remote places. The villages, the infrastructure needs proper, designing, proper facilities are needed so that the doctor also serves there willingly and happily, and the patients also get better services. So, sir, we'll be happy if you take one or two questions from us.
Sure, sure.
Okay. My first question to you is, what are some of the basic challenges, say one or two main challenges that you remember that you have faced and would like to share with us, and how did you cope with those challenges?
I think if we remember our college days, because now I'm working in a private hospital, that is a different scenario. But I'll share my time during my college days. One of my Professor Zinat Ansari, she is no more today. She did. I mean, when she took our first lecture, she said to me that, look, in India, more people die because of poverty rather than disease. So in my ward, no one should die of poverty. आप अपनी जेब से पैसा दीजिए, आप कहीं से लाइए, चोरी कीजिए, जो करना है आपको करिए, आप मरीज़ का इलाज आपको करना है और मेरे वार्ड में कोई बच्चा गरीबी से नहीं मरना चाहिए। आई थिंक दैट इज़ द थिंग व्हिच वी हैव टेकन सो फार, अभी तक हम लोग कर रहे हैं। हमारे पास वी यूज्ड टू गेट वेरी पुअर पेशेंट्स एंड वी यूज्ड टू गिव देम द लिस्ट कि भई आप ये दवा लेके आइए, ब्रिंग दीज़ मेडिसिन्स। वो कहता था साहब मेरे पास तो पैसे नहीं आए, एंड यू विल नॉट बिलीव हम लोग अपनी जेब से पैसे निकाल के देते थे कि जाइए इस दवा लेके आइए एंड विल ट्राई टू सेव योर चाइल्ड। So this is how our teaching has been done, and most of the doctors have been trained like that. Or this is, I think, one thing which I would like to share that, uh, as I said, that all doctors, even now, there are so many poor patients come into our clinic, and we do treat them, and we do take रिस्क एंड ट्रीट देम एंड गॉड विलिंग दे वो ठीक भी हो जाते हैं और चले जाते हैं, दुआ दे के जाते हैं। माई सेइंग इज एज ए डॉक्टर इन ए प्राइवेट सेटअप इज दैट कि आपसे मरीज कुछ लेके नहीं जाता, वो आपको दे के जाता है। अगर आपको पैसा नहीं दे के जाएगा तो आपको दुआ तो दे के जाएगा।
Very, very beautifully put, sir, because that's a beautiful thought that no patient should die of poverty. That's
या
very, very important. All lives are much above and much beyond money. So that's a very noble thought put forth. We all are very much aware of the saying that doctors are famous for keeping their patients in the pink of health. And as you said, we need to be grateful. That one thought of yours, where you said that there is a loss of trust between the patient and the doctor. Now, when we are in the pink of health because of you, doctors, I think what message is there for you that can, rebuild the loss of trust between a doctor and a patient?
I think the most important thing is that I'm not saying that everything is very right on the doctor side as well. There
Very
are
true.
some issues, there are some problems, there are some black sheeps in our community as well, but they are very few. I mean, if you take the advantage, you cannot generalize it that every doctor is taking the cuts in the commissions or the. Actually, the problem is the infrastructure of our health system has to be improved. The health insurance is the only answer, I suppose, because in private sector, when the patient has to pay heavy amount of money, he is earning like 15,000 per month, and one day in a hospital he has to spend 20,000 rupees in a day. Where is he going to bring that money from? So I think the time has come. If you go to USA, the health the system is very costly, but they are all insured because the insurance companies, so that they are not worried. The problem is that patients are poor. The setups are not offering much services, so they are bound to go to private hospitals where they have to spend money, but their earning is very less. I mean, जितना वो एक दिन में महीने में कमाते हैं उनका एक दिन में खर्चा हो जाता है। तो आई थिंक इट इज़ हाई टाइम दैट वी नीड टू encourage medical insurance, क्योंकि अब nowadays if somebody is admitted in a private hospital, I think अगर आप एक हफ्ते में if you are admitted for 1 week, the bill is going to be more than a lakh or so. uh,
Very
सो
true.
वेयर आर यू गोइंग टू ब्रिंग दैट मनी फ्रॉम? आज मैं भी सोचता हूँ अगर अगर मुझे कुछ हो जाता है और मुझे कहीं कॉर्पोरेट हॉस्पिटल में एडमिट होना पड़ेगा, 10-15 लाख रुपए मैं कहाँ से लाऊंगा? तो आई थिंक दिस इज द टाइम दैट पीपल शुड गो फॉर मेडिकल इंश्योरेंस, सो दैट दे आर उनका एटलीस्ट फाइनेंशियल बर्डन उनके पास नहीं आएगा। देखिए प्रॉब्लम कहाँ आती है, अब पेशेंट मेरे पास एडमिट हुआ, मैंने इसको सीरियस था, मैंने एडमिट कर लिया, अब उसका बिल बढ़ता जा रहा है, बट हम उसको आगे रिफर नहीं कर सकते बिकॉज अब पेशेंट जाने को तैयार नहीं है, प्लस वो पैसा भी नहीं दे रहा है। अब हम क्या कर सकते हैं? तो यहाँ पर प्रॉब्लम यही आती है कि हमें उनको हैवी डिस्काउंट देने पड़ते हैं, बट अगर वही मेडिकल इंश्योरेंस से होगा तो उसको पैसे का टेंशन नहीं होगा, तो वो आराम से कहेगा कि डॉक्टर साहब आप हमारा ट्रीटमेंट कीजिए। तो आई थिंक इट इज़ हाई टाइम दैट मेडिकल इंश्योरेंस शुड कम इन टू प्ले, so that the people's burden is shared, because everybody is not earning that much, okay, so that they can spend in a private hospital for the
Absolutely,
diagnosis.
that is what the commoners. Where are the commoners going to fend for themselves?
Yeah.
And in the escalating prices and the rates in everything, sir. So that's a very very relatable answer that you have given. Uh, Now, the major challenges that the present healthcare is facing in present times. What is your take on that?
I think the major challenge is, I mean, the poor health infrastructure. I mean, in the government setup, if we talk about, and the the mishandling of doctors. I think this is a major challenge in our working these days, because recently you see that Dr. Archana had to commit suicide. Just one patient died because of the PPH. She was all the night working for her, gave blood, treated her with her own money, and despite that, the local goons and the local politicians, they misguided her husband and created ruckus in front of his hospital. She was so scared that she'll go to jail and she committed suicide. I mean, this pressure has to come down. We as a doctor is experiencing it every day. So I think this pressure from the society, भाई हमें काम करने दीजिए। एंड जो मैं अपने सारे पेशेंट से कहता हूँ कि आजकल लोगों का भगवान से विश्वास उठ गया है। पहले तो डॉक्टर को भगवान कहते हैं, पर जब पेशेंट की डेथ हो जाती है तो उसी भगवान को फिर आप मानना शुरू कर देते हैं। तो जो कॉमन परसेप्शन है, जो मैं कह रहा हूँ ना कि आजकल अ, कोई पेशेंट अपनी नेचुरल डेथ नहीं मरता है, सबको डॉक्टर्स ही मारते हैं। ये एक ऐसा सिचुएशन बन गया कि हम सब वहाँ गए थे, डॉक्टर ने ये गलती कर दी, ये इंजेक्शन लगा दिया। एवरीबडी वाज कमिंग टू मी फ्रॉम डिफरेंट हॉस्पिटल इज सेइंग कि साहब उन्होंने ऐसा कर दिया। तो ये गलत है। मैं समझता हूँ कि यहाँ पर आई विल रिक्वेस्ट माई सोसाइटी, रिक्वेस्ट अवर कम्युनिटी, जो भी लोग हमारे इस वीडियो को देख रहे हैं, प्लीज़ अपने डॉक्टर्स पे ट्रस्ट कीजिए। डॉक्टर्स अपनी काबिलियत के हिसाब से जो बेस्ट पॉसिबल है, ही इज़ डूइंग, ही इज़ गिविंग, डिलीवरिंग इट टू यू। उसका कोई इंटेंशन नहीं है, आपसे उसकी कोई दुश्मनी नहीं कि आपको गलत इलाज दे देगा, गलत इंजेक्शन दे देगा। तो यहाँ पर इस ट्रस्ट को डेवलप करने की ज़रूरत है। अगर ये ट्रस्ट डेवलप हो जाएगा तो हम लोग भी फ्री होकर काम करेंगे और हम लोग अपनी कम्युनिटी को और बेहतर सर्व करेंगे।
Very true, sir. Our mindset needs a change in the
बिल्कुल
present
बिल्कुल
time
ज़रूरी है, चेंज होना
because
ज़रूरी है।
I agree that when we go to a doctor, we go with a lot of hope. We look up to you as saviors, After God, we know that yes, a God above and the doctor below. We don't
Yeah,
need anybody else. So we do go with a hope that when I go to a doctor, I will come back healed. But then we should understand the doctors are not our enemies. They are
yeah,
there to guide us, to help us, and they are doing their very best. There may be stray cases, as you said, that yes, sometimes there have been cases which have been reported as negligence. So there, we cannot ignore that. But on the whole, nobody is perfect. We should understand that no profession can be termed as perfect. So we need to give that much of, a benefit of doubt to the profession of doctors also. And we need to lend a helping hand, all support to the doctor fraternity, because you are there to heal us and not to kill us. So that's the message
yeah,
that I would like to convey to our viewers, to everybody out there who's on the show. The doctors are our friends, please, and let's look up to them in the best ways possible. If we walk two steps, they are there to cover those 1,000 steps. that is the space between a doctor and the patient.
Very true. Very true.
So I would like to ask you that since it's a very hectic life, you are, running on emergencies 24/7. How are you able to manage and create a fine balance between your home life and your profession?
Yeah, I think that is a very interesting question, and I am blessed to have a beautiful family, and I do spend time with family. My time starts after 11 p.m. I must say that because whole day we are working in the hospital, since it is a private hospital, so I have to do evening clinics as well. I usually come by 10:30 to 11 o'clock, and my life starts after 11 p.m. After that, I sit with my family. We go out, and that's why we sleep a bit late. Our routine is a bit disturbed. But if we don't do that, then our own personal life will be, I mean, compromised, and I don't want that. So we need to relax ourselves. We listen to music. We go to movies. We go to
Definitely.
dine outside with the family. So that is, obviously on the weekends, when the clinic is off in the evening, we do enjoy. And I'll request every doctor to give their family the proper time, because आपकी family आपकी primary support है. तो family को time देना, I think it is a must, and I am blessed to have a wonderful family and which I am giving enough time.
Very true, very true. So out there, all the doctors out there who are, very busy and walking that extra mile to be there with their patients, you're doing a wonderful job. We all congratulate each doctor out there. But then Dr. Baig says that it's very, very important to maintain that fine line and a fine balance where your families also need you. They too need your care. We've heard of doctors where their family members needed them the most, but then they left them to tend their patients. I
Yeah,
think that's just amazing and awesome. And it's just a salute from my side and from my team to
thank
all the doctors who are, having that feeling of selfless service. We really appreciate, and no two words of thank you can suffice. No
thank
two
you, man.
words of
Thank you
thank
very
you
much.
are enough to say that thank you, doctor, you did a lot. It's more than that thank you. And we just pray that may your days be wonderful and healthy like you make it for others. And we know that medicines cure diseases, but only a doctor can cure patients. A
Yeah,
few lines for you, wonderful doctors, from our side is the doctors are one of the most inspiring figures of the society, and they should be celebrated every day, not just on the Doctor's Day. Celebration of doctors every single day. And only a doctor is blessed with the magical powers to treat a life, to bring health, positivity, and a will to live in the hearts of patients, and they change the minds who have lost all hope. So, kudos, keep up the good work, all you doctors. We look up to you. We cannot do without you. All said and done, we cannot do without you. So, thank you so much, Dr.
that's
Beg.
really encouraging, Zoya, ma'am. Your words of, I'm really thankful and grateful. And if our society start thinking the way you are thinking about us, I'm sure we are, the
No, thank you, sir. Thank you.
doctors also will improve, and the society in
Yeah,
general will
and
improve.
sir, we have been we knew about it all along, but during the pandemic, I think we salute the doctors all across the globe.
Thank you very
You all
much.
have done a job that is commendable beyond words. Words are rare to measure your work and your services.
Thank you very much.
So, once again, a very big thank you, a very, very happy Doctor's Day to each doctor, whether you are in a foreign country, you are in a village, you are in a town, you are in a city. Each doctor is as important as one who is serving in the remotest area right now. So remember, we as a community, we look up to you. We are joining hands in helping you in more ways than one. And you are doing your bit, and God is there to do the rest. And of course, our government is listening, our society is listening, our NGOs are listening, and we are all there this is the wake up call in a way for each
Yeah,
one of us here
that is
to
true.
lend the support system that is very much needed to this noble profession. Thank you so much. Thank you,
Thank you.
audience. I think you have wonderful takeaways from Dr. Baig. Let's all join hand with him and do something really that says doctors are life givers. Thank you so much. Stay
Thank you very
blessed,
much. And I
everybody.
must thank Getty for giving this opportunity and to share my experiences and share my thoughts. I salute you, Getty.
Thank you so much. It was a pleasure having you on the show. Thank
Thank
you.
you. Thank you very much.
Stay blessed, everybody.
Bye bye.
Bye, sir.